Good morning, Vandana. It's really a pleasure to have you here. Dr. Shashi is professor of pediatrics at Duke University, and we're really excited to be able to interview her about her seminal work in the Undiagnosed Diseases Network and as a clinical geneticist. Thanks for joining today, Vandana.
Oh, thank you, Swati. It's a pleasure and an honor to be here.
Vandana, it's been so great to be able to work with you over the past, 15 years. And I'd love to hear about you and your career and how you got to where you are today.
Oh, okay. Thank you. Yes, so I'm a clinical geneticist and a pediatrician. I did my medical school training in India, did my pediatric residency there, then moved to the UK for a couple of years, worked in pediatrics, and then came to the US. So it's been a long journey. I am a boarded clinical geneticist. I did my genetics training at University of Virginia and did a pediatric residency as well at Wake Forest University. And I've been working in genetics, gosh, now I have to go back and say 25 years now. So it's been a long journey. I've been at Duke for about 13 years.
Vandana, can you tell us a little bit about what your day-to-day life is like?
Sure. I spend about 80% of my time on research and 20% on clinical work. My clinical work involves seeing patients who don't have a diagnosis, sometimes patients who have a diagnosis that I follow. I also have two specialty clinics that I'm part of. One is a chromosome 22q deletion syndrome, which is also a research interest of mine. So I see patients across the lifespan who have this genetic disorder and provide them care. I also participate in a multidisciplinary Down syndrome clinic, and I do a little bit of inpatient call. So my clinical activities really keep me energized, and they also lead me to develop some research questions that I can then take over into the other aspect of my job. So 80% of my job involves doing research. Much of it is spent on the Undiagnosed Diseases Network. I also participate in studies related to 22q deletion syndrome, and I'm part of a Duke Function Center grant that looks at non-coding variants. So those are my research activities.
That's great, Vandana. You're involved in so many different things. I know one big passion of yours and where you've been a leader is in the Undiagnosed Diseases Network. So could you tell us a little bit about how that study came about, what your involvement has been, and what Duke has been able to do through that program?
Oh, thank you, Swati. Yes, so the Undiagnosed Diseases Network is an NIH funded study through the NIH Common Fund. It was first started in 2014, and we're in the second phase, which runs through June of 2022. So because there were so many patients with rare and undiagnosed diseases that had difficulty obtaining a diagnosis, the NIH expanded its own program called the Undiagnosed Diseases Program into a network. So there are 12 clinical sites that are part of this network, and we are one of them. They're supported by codes for sequencing, for animal modeling, for metabolomics, and a coordinating center. So patients who have these rare diseases or symptoms that have been refractory to medical investigation are free to apply to the network. Everybody is eligible, even international patients can apply. And all applications come through a portal that is looked at by the coordinating center, and then the applications are triaged to a clinical site, usually depending on geographic location. So we get applications from North Carolina, South Carolina, part of Georgia, as well as some neighboring states, including a little bit of Virginia. And so if patients who are reviewed are eligible, they travel to Duke and they stay here for a week. Now with the pandemic, we've had to alter some of those procedures. But they get phenotyping done, and if indicated, if an underlying genetic disorder is suspected, we use state-of-the-art sequencing, followed by techniques such as RNA-seq, animal modeling, in order to make a diagnosis. So at Duke, we probably evaluated over 240 patients, and we've diagnosed about 47% of those individuals, which I think is remarkable because these are individuals who've already failed a lot of diagnostic, I shouldn't say failed, who have not been able to be diagnosed with prior diagnostic approaches, including exome about 80% of the patients we accept have already had an exome elsewhere that has not been diagnostic. Duke has also contributed to many new disease gene discoveries. We've had about 13 new rare disease genes that we have discovered as part of our site. Our site is also unique in that we focus on the psychosocial aspects of being undiagnosed. What does it do to these parents and their patients themselves when they are faced with this disorder that has been difficult to pin down as to what it is? Because if you don't have a diagnosis, you don't know what else to look for. There are no treatments. So we look at that aspect as well. And we even developed a measure looking at how do people perceive genomic sequencing? What do they expect? How are they able to utilize this information because it's complex? So we kind of look at the patient as a whole. And we use all of the psychosocial information we gather in kind of trying to tailor each individual's genetic counseling, and how we handle, how they handle the information is really important to us when we talk with them.
Vandana, that's so amazing. I think shortening the diagnostic odyssey for patients and families is really important, and you've been able to do a huge service to our patients in that way. Can you talk a little bit more? Does this change the way the patients are taken care of once they're able to get a diagnosis through the UDN?
Yeah, that's a great question, Swati. For about 30% of the patients is actually a change in management. I will say that cures are rare and unlikely to happen in genetic disorders, but many times there are new clinical trials that a patient might participate in. For some patients, a drug that's more indicated for their disorder based on a diagnosis is available and be switched. For some patients, it's like looking out for new medical manifestations that they had been aware of. Their screening changes. And for many families, knowing information for future pregnancies has also been a really important thing. And so many of these new disease gene discoveries, now there are patient foundations that are being set up. I'm amazed at the resiliency and the strength that families have in trying to move ahead with this information we give them. I know of several of our families who've set up patient foundations, raising funds, trying to find specific treatments, including things like ASOs, pursuing gene therapy. So there are all of these options that are opening up for these disorders that were not there previously.
That's great. Thank you, Vandana. The work that you've done in the UDN is really transformative, and it demonstrates how genetics can be used not just for research, but also to help our patients. Can you talk a little bit about what you think the vision for genetics and genomics is over the next 5 to 10 years?
Yeah, I think so. If I would look at it in two different domains, diagnosis and therapeutics. I think diagnosis, we already know, has been revolutionized by sequencing. In addition to exome, which is now clinically available, I think it's a matter of time before genome becomes more widely available. And there are pros and cons to that, but I think there are more pros than cons to the use of genome in clinical practice, and I think it's going to come. I also think that in the future, RNA-seq will be used as an adjunct in clinical diagnostics. For the few cases where you think that's really going to be helpful, I think that'll be available. We also have new technology such as optical genome mapping, wherein you can really find small deletions and duplications that a chromosome microarray might not find, or a whole genome is not very good at finding. So I think CNV detection is going to improve. I don't know yet where long read sequencing is going to fall into the spectrum of diagnoses. I think time will tell with that, but I certainly think genome, optical genome mapping will be part of clinical practice very soon with that RNA-seq. For therapeutics, I think we're kind of at the horizon here of new things that are going to come up. We've all known gene therapy has existed for a long time, and gene therapy is still a great option for specific disorders. But I think other approaches such as drug repurposing for very rare, ultra rare disorders where new drug development is not an option is the way to go. So for example, if you have an ultra rare disease that affects 100 people in the world that you know, doing a randomized control trial with a new drug for pharma is just not incentivized enough. So I think we're going to have to look at creative ways to help treat some of these ultra-rare diseases. So drug repurposing of already approved drugs, as well as new approaches such as ASOs, I think are already being used, and I think that will expand. My hope is somewhere in the future, we will be able to give all these families some hope that there are specific treatments for their disorder.
Vandana, thank you so much. You're an inspiration. The way you've been able to link research with how you take care of patients in a very transformative way will be an inspiration to many generations to come. So thank you so much for your time and your insight today.
Thank you, Swati. I appreciate the opportunity to be on this interview and to collaborate with you as well. Thank you for spearheading the Collaborator.
Thank you.